नमस्ते, हमेशा खुश रहो बिटिया. This is JV'n, Dr. Meenakshi Soni, Department of Homeopathic Repertory, ज्योति विद्यापीठ, Women's University, Jaipur. This is our clinical class. Difficulty in chronic case taking. Case taking is the process of collecting all the fact about the patient using various tools like observation, perception, history taking given by the patient and attendant, clinical examination, etc., in order to find a remedy for the patient and using our knowledge of homeopathic materia medica, organon of medicine, and repertory. Objective of case taking collection of all the fact pertaining to the patient which may help in the reaching the totality of patient and thereby help in offering the correct similimum. It is also said that a case well taken in is a case half cured. The influence of modern system upon the pupil. This is the difficulty. A physician trained in modern method of treatment does not trouble the patient much by way of asking question for case taking. The patient who are accustomed to such more procedure and influenced by these techniques come to a homeopath and expect him to follow the same procedure without touching the patient much in the way of interrogation and prescribe medicine for his trouble, yet expecting to have better result. This is the first problem during the chronic case taking. Second, change symptom image when all the possibilities of allopathic medicine including the surgery fails, patient come to the homeopath as their last resort. By the time he must have consumed large quantity of strong drug continuously for a long time, the already consumed drug must have produced their own symptom, drug proving changing the symptom image of original disease, thus making the homeopathic physician incapable of making radical prescription. This is the second problem. The third problem, complex disease. Allopathic medicines are not prescribed according to the symptom similarity, are repeated quite often and unscientifically when natural chronic disease are treated with these drugs. They produce their own symptoms. ड्रग डिसीज जिसे हम बोलते हैं and intimately mix with the main disease. When pathology progresses, the sign and symptoms decreases. Many diseases such as cancer usually comes on later in life when childhood matters have been forgotten. They don't remember the past history or the family history. Pathological changes have already taken place. In proportion as the pathology progress, the sign and symptom decrease. In the absence of sign and symptom, totality of symptom, the choice of medicine is not possible. And on pathology alone, no prescription can be made. Modesty conceals the facts. There are certain conditions and suffering which the patient may not like to the doctor due to modesty or the shame. Due to modesty, patient conceal the facts and give vague symptom which make the correct prescription difficult. For example, habitual masturbation, leukorrhea in female. Pretension modifies the symptom. Certain patients exaggerate their symptoms, narrate more than they feel. Some patients narrate less than they feel. In certain grave disease, they don't complain about their suffering. These are hinder the proper case taking. Patient accustomed to long sufferings. In chronic disease, the patient get accustomed to long suffering and may not feel the necessity of narrating the symptom with which they have lived for long, which are important for choice of medicine. They don't consider that these symptoms have anything to do with the prescription that has to made for the present trouble. Symptoms appearing periodically are not narrated. Symptoms appearing periodically are important factor which will help in the selection of medicine. The patient being ignore of the importance of such symptoms occurring periodical along with the main symptoms may not narrate these while giving their case history. For example, rheumatism during winter, diarrhea during rainy season. Alternating symptom not narrated. Certain use symptoms usually alternate with one another. They don't understand the importance of such alteration symptoms. Moreover, they are not aware of such alternation, thus making the proper prescription impossible. The long suffering considered incurable. The treatment for the new disease cannot be considered until a complete picture of old symptom is obtained due to gradual progress of chronic disease. Many symptoms are produced one after another and with which the patient might have been living since long. During this course, some serious disease develops, which are the result of exciting chronic disease. Patient ignoring of old symptoms, exciting chronic disease, and is thinking that they are incurable, seek treatment for new disease. So the complete picture cannot be obtained. Unhomeopathic, homeopathic medicine, some doctors prescribe complexes and tonic eye drop and nasal drop to their patient. Each complexes tonic contain 5-6 medicines. When they are administered, it will produce their own symptom, which will be more dangerous to the patients than natural disease, so that it would not have been possible for homeopathic medicine to overpower the natural disease and cure it. Usually, homeopathic medicines are more powerful than natural chronic disease. Complexes and tonics are not prepared according to the symptom similarity. They will produce their own symptoms and create a medicinal chronic disease. This will mix up with the natural chronic disease and make a complex disease which will be incurable. Self medication, that is the problem of our country. If the patient get well by self medication, he does not come to a doctor. But if the symptom remain, he come to clinic. As a result of prolonged medication, the symptom remains suppressed and cause a problem for physician. Mixed miasmatic disease. There are certain diseases which have a combination of psora, syphilis, psychosis in a complex. It is very difficult to penetrate in these cases. One-sided disease. These diseases present to few symptoms for judicious prescription. So these are the difficulties during the case taking. Hope you understand the topic. If you have any query, please mention in the comment box. I will resolve it quickly. Thank you.